right now we are hearing certain politicians try to pander to the least common denominator. Now, why would that be what they are attempting to do? Well, because of the education system, or lack thereof, the liberal indoctrination factories that are called public universities, and under the guise of education, they indoctrinate you to be subservient to the state. Under the guise of fairness, they want to increase your taxes, control over your life, your family's life, and ultimately control over humanity. Now, I do not begrudge individuals that are working 40 plus hours a week, that have families, that in between work have family responsibilities, soccer games. They want to spend some time with their significant others. They want to watch football. I understand and I sympathize with those individuals. But that, along with the public indoctrination, is the root cause of the symptom. And the symptom is that politicians are pandering to the least common denominator when they speak about things. The most recent phenomenon is single-payer healthcare. If you do not understand economics, if you don't understand the complicated, dry as sandpaper world of insurance, you do not understand anything of that nature, and you do not take the time to read about it, when you hear an individual like Bernie Sanders, Elizabeth Warren, any of the Democratic candidates go on the stage and state that we need Medicare for all, you hear their emotional appeals. Like saying, when someone is on the street and they end up having a heart attack, they go to a hospital, they are bankrupted for life because they are uninsured. You hear them talk about sob stories about single mothers, college students. Instead of using analytical data or evidence, they play on your emotions because most of your decisions are not made analytically. Most of your beliefs are in your subconscious mind. So if politicians can give you sob stories about why we need a single-payer healthcare system for every individual, you will subconsciously believe in their sentiments. Now let me get into my reasoning why I think Medicare for all would be an absolute catastrophic disaster for this country, the working class, and the individuals who are forced to have that health care. I will get into an algorithm that I created that I think every healthcare policy that is worth a damn should adhere to. And then I will get into some market-based solutions that I think can lower the cost of healthcare. Any good snake oil salesman, false prophet, TV evangelist, they will tell you something that is unequivocally true. They will point out a problem. But rather than giving you the right solution to that problem, they will give you snake oil that they tell you will solve whatever problem you're facing. So when a politician says that healthcare prices are skyrocketing, that is an unequivocally true statement. But how to lower those costs to the consumer is a completely different ballgame in terms of what they're trying to give you. Now let's get into why I think Medicare for All is not the right way to go. Data from American Hospital Association's annual survey of hospitals revealed Medicare and Medicaid reimbursements fell $76.8 billion, that's billion with a B, short of the actual cost of treating beneficiaries in 2017. Specifically, Medicare reimbursements were $53.9 billion short of actual hospital cost, while Medicaid underpaid hospitals by about $22.9 billion. The AHA reported, that's the American Hospital Association, Medicare and Medicaid underpayments occurred because the large public payers set reimbursement rates through rules and regulations, rather than negotiations like with private payers and managed care organizations. Typically, the Medicare and Medicaid payment laws set hospital reimbursement rates below the actual cost of providing care to program beneficiaries. When you have a private insurer, they negotiate market-based prices. But when you use an institution like a government, what happens is they set laws. They set a cap on how much hospitals can charge. It is a take it or leave it type of thing rather than a market-based negotiation. For example, the most recent AHA data showed that hospitals only received 87 cents for every dollar they spent caring for Medicare and Medicaid beneficiaries. Medicare reimbursement refers to payments hospitals and doctors receive as a result of services provided to patients that goes to the billing provider. Doctors can choose to accept the rate that Medicare has set for the services they provided. Medicare pays 80% of these costs. Medicare is primarily funded through payroll taxes. For those of you that are unaware, payroll taxes pay Social Security and they pay Medicare. What happens is the employee pays 6% of those payroll taxes, and the other 6% is paid by the employer. But to be clear, 12% of your paycheck is already gone before it gets into the bank, simply because of payroll taxes. So Medicare is primarily funded through the Federal Insurance Contributions Act and the Self-Employment Contributions Act. The money is set aside in a trust fund that the government uses to reimburse doctors, hospitals, and private insurance companies. So when the doctor gets paid 80 cents for every dollar, that money that is reimbursed to them is paid back in taxes in a trust fund. And that is under the Federal Insurance Contributions Act and the Self-Employment Contributions Act. Additional funding comes from premiums, deductibles, coinsurance, and copays. And so the issue with the Affordable Care Act is that it did not attack the issue of cost. And we'll get into my algorithm that I created, that I think if you are able to solve three of these things, you can create an effective healthcare market-based solutions plan. But there's always going to be cost. You cannot hide cost. The question is not how do you get people insured. The question is how do you pay the doctors for the care that they provide. Because not only do they have those trust funds that pay the reimbursements, but it increases the cost that patients who are covered by commercial insurance have to pay. It places an unnecessary cost on non-government patients and their employees. If you're a healthy individual, like most of the population, you diet, you don't smoke too often, you're not an alcoholic, you use a private insurance company, then you have to pay more to the doctors because of the under-reimbursement forces based upon politicians, not businesses, not private insurance companies negotiating, but based upon politicians writing laws and laws that negotiate a cap on how much Medicare and Medicaid patients can charge those doctors. There's also a call by Bernie Sanders to get rid of the entire commercial industry. That would mean 5,308 and 600 people would be out of work. The impact on the financial stability of hospitals and doctors would be staggering. The elimination of existing systems would be offset by a large increase in government payrolls. A Meritor Center study estimates that Medicare for All would cost the federal government around $32 trillion. These estimates do not include likely increases in Medicare and Medicaid rates required to lessen losses to hospitals and doctors. If the doctors and the hospitals are going to provide cost, you're going to have to reimburse them. See, if your whole goal is, I want to make healthcare cheaper, but you're not going to lower the supply, but you're going to increase the demand, what ends up happening as a result of the ignorance is that doctors are forced to either provide less quality, less supply, or they have to be reimbursed for losing money on providing those costs. These estimates is what I'm referring to. The federal government cannot cover them without new revenue, as the current U.S. debt is $22 trillion, with the annual deficit exceeding $1 trillion per year in 2020 and beyond. The Committee for a Responsible Federal Budget estimates that Medicare for All would require tripling of payroll taxes, or more than doubling all other taxes. The Maricactus Center Foundation found that doubling all federal, individual, and corporate income taxes going forward would be insufficient to fully finance the plan. In one of my previous videos, I talked about how the average person to pay all of their local, state taxes, all of the taxes per year that they owe, property, etc., have to work 94 days a year, which is over 2,000 days a year. So if you give Medicare for All, the average person would have to work more than 94 days to be able to fully fund that to take place. The majority of government revenue comes from payroll taxes. So at least I'll give Bernie Sanders this. Even though I disagree with the guy on his policies, and I think he's a nut job, he at least is not disingenuous like Elizabeth Warren. He at least admitted that Medicare for All would cause taxes to have to be increased. On his website it says by 4%, but by that much it would not raise enough revenue. But I'll give him credit that he at least attempts to admit